Hello, my name is Dan Austin, and I am the clinical coordinator of the High Risk Heart Institute here in Victorville, California. Fortunately, I'm also one of the co-formulators of Arginetix, along with Dr. Siva. I met Dr. Siva over 20 years ago at one of the local hospitals. He had been recruited by that hospital to upgrade the cath lab. And I knew that I had met someone special, someone significantly different than other cardiologists. My background is basically over 30 years of emergency and critical care nursing. But when I met Dr. Siva, I knew that I met someone different. When I say different, I mean that he was using a product, a nutritional supplement, L-arginine, in a specific patient population of his. I was triaging some patients in the emergency room one night, and I saw these patients taking L-arginine. I had the opportunity to talk with him a few days later, and I said, Dr. Siva, I said, what's this L-arginine do you have these patients taking? And he said, well, these patients are maxed out on nitrate therapy and everything, so I told him to go to the local health food store and pick up L-arginine. It comes in 500 milligram capsules. Take it as directed. I said you could actually double the dose to 1,000 milligrams 3 times a day. And what it will do is, at that time, there was the Nobel Prize that was given to 3 scientists back in 1998, showing L-arginine as a precursor to nitric oxide. Up until that point, nitric oxide was basically known as EDRF, endothelium-derived relaxation factor. So it was at that point in time I realized that he was an interventional cardiologist, from Cedars-Sinai Medical Center. He was using nutritional supplements, in conjunction, with medical management for patients, for certain type of patients, in this case, angina, patients who had chronic chest pain that was unrelieved with exercise, with rest, or it was created by any type of exertion. So over the next few years, Dr. Siva and I started using some nutritional supplements together, and he provided some patients in the study. We started looking at patients with congestive heart failure. Then one day I got a phone call from him, and he said, Dan, I'm building a new facility that's going to have everything under one roof, and I want to put a congestive heart failure clinic, and I want you to run it. I said, thank you very much, I'll be there. Why did he start a congestive heart failure clinic, and why was it the first one of its kind? Well, Dr. Siva basically was treating the sickest of the sick. He was the first interventional cardiologist to put internal cardiac defibrillators, pacemakers, in patients, which means they had a very low heart function. They had a very, very low ejection fraction, less than 30%. Our patients, those patients were living longer because of those ICD implantations. So they were living around longer, so it just made sense to be able to have a clinic, an outpatient clinic, for them to come to, to be able to empower them, to be able to teach them more about their disease state, other comorbidities they may have, such as hypertension, diabetes, peripheral vascular disease, angina. So we wanted to be able to have an environment for these patients to be able to learn more, be empowered, and keep them out of the hospital for the number one admitting diagnosis, which is congestive heart failure. So that became the journey, that I started as the clinical coordinator for Congestive Heart Failure Clinic. And about 10 years ago, I presented to him a nutritional supplement, an arginine complex here, and I said, Dr. Siva, how can maybe this L-arginine complexer have a benefit for our patients here? He looked at it and he said, you know what? We've been using L-arginine for certain patients of my population going through. Let's take a look at it. Let's look at some subset of patient population, and let's do it. So he spent over $250,000 of his own money over a 6-month time period, and we did over 5,000 points of measurement, and we enrolled 35 patients, of which we had patients who had basically been medically managed to the full amount, meaning that if they had hypertension, they were on 3 to 4 different blood pressure medications. If they had peripheral vascular disease, they were on medications to try to open up the arteries as much as possible. If they had angina, they were on nitrates maximum out, or they were in EECP therapy, which produces nitric oxide. If they had pulmonary arterial hypertension, they were on medications which were very expensive at the time, but also these medications weren't also that many medications presented to patients. And it was a very progressive disease, had a very high mortality rate. So, and then we also had a small subset of patients who had a very high familial risk. Their parents died in the ages of the 40s of cardiovascular disease. So we followed these patients and we came away with some fantastic outcomes, okay, with the L-arginine complex. But Dr. Siva is never one to rest, okay, with what we have. And so his promise was, if we ever find something, okay, that can make a better mousetrap, you might say, make something better, okay, offer something good, better for the patient, okay, that's always his goal, his promise. Always been his promise in the congestive heart failure clinic, that's all he promised to his patient. So we came across a couple other ingredients. One was an ingredient called estrogen. And so what we did was we added this estrogen, okay, to the other arginine complex that we were using at the time. And we were amazed to see that how we were able to reduce dosing of the arginine complex with the ingredient of that estrogen. And not only did we find out what we did, but we also got better absorption of vitamins and minerals, and it affected patients, certain cardiac patients of ours, by raising magnesium levels, like, for example, and reducing cardiac irritability, reducing their PDCs. This is important from our standpoint of cardiac patients in that aspect right there. So it was one of those little aha moments in that aspect. Secondly, what we did was we also found a different type of a vitamin K called vitamin K2 or Q7. And when we did that, we were basically looking at a 3-year study on postmenopausal women that looked at what was the most efficacious dose in reducing arterial stiffness, okay, which is basically atherosclerosis or hardening the arteries. And in this aspect here, it was 180 microgram dosing. It was 45, 90, and 180 micrograms. So what he said was, you know what, let's put the most efficacious dosing and offer that and see what that does. And what that did was we saw some improvement in reducing the systolic blood pressures in our patients there with severe atherosclerosis. So our goal, our pledge to our patients was make sure that we always have the right ingredients to be able to help our patients, the whole patient, not just the congestive heart failure pair, the whole patient. So what I've been able to do, okay, with the assistance of Dr. Siva and my staff at the Heart Institute, is I've been able to offer a pharmaceutical grade nutritional supplement, okay, that has had such a profound effect on overall health. We've been able to reduce, okay, hemoglobin A1Cs by well over a full point, okay, in just 90 days. We've been able to take a diabetic patient to pre-diabetic patient. We've been able to take a pre-diabetic patient to a non-diabetic patient. Okay, we've been able to implement, okay, vitamin D into our clinics to where we've now taken patients and reduced the incidence of overall mortality by up to 60%, okay, by raising the vitamin D levels, okay, to levels where they should be and not to where other substandard levels may be at. So again, I've had the pleasure of working with a cardiologist who thinks outside of the box, okay, who's constantly looking at ways that we can improve, okay, that we can offer a product to the world, because right now it's been in our backyard for several years. What we want to do is we want to get it out to the world. We're working at it, okay, one state at a time. We are in 31 states right now, and we have a program called the Ambassador Program that's probably sort of started out as a sort of a Johnny Appleseed from one of our patients that started traveling around the country because his eyesight came back because of the use of this product. And so he decided to take the product and start giving it away. And then we started tracking down how it was being used. So in my 30 plus years of critical care nursing, open heart, emergency nursing, I'm proud to say that I have in front of me probably the most profound nutritional supplement that has an overall effect on someone's health, whether it be for disease prevention, for my children, okay, or for overall wellness for not only my patients, which I hope that you will take the time to look at some of the videos of my patients, our patients at the Heart Institute. And again, I want to thank Dr. Siva for also this journey that we're on right now.